Question 1. Cost-benefit analysis shows that while some clients may request specific fitness assessments based on personal preference or past experience, a certified personal trainer's primary responsibility is to ensure the assessment is safe, valid, and reliable for program design. Considering this, which approach best balances client satisfaction with professional duty when a client insists on a particular, potentially suboptimal, cardiovascular fitness assessment method? Option A. Immediately perform the assessment requested by the client to ensure client satisfaction, regardless of its scientific validity or safety for program design. Option B. Conduct a non-standardized, improvised assessment that incorporates elements of the client's requested method but is not based on established protocols. Option C. Educate the client on the benefits of a standardized, validated assessment method that aligns with their goals, and propose a suitable alternative if the requested method is deemed inappropriate or unsafe. Option D. Refuse to perform any assessment if the client insists on a method the trainer deems suboptimal, without offering any explanation or alternative. The correct answer is C. Educate the client on the benefits of a standardized, validated assessment method that aligns with their goals, and propose a suitable alternative if the requested method is deemed inappropriate or unsafe. Explanation. Scenario analysis. This scenario presents a common challenge for personal trainers, balancing client expectations and perceived needs with evidence-based practice and the ethical obligation to provide safe and effective programming. The client's desire for a specific, potentially outdated, assessment method creates a conflict between client satisfaction and professional integrity. The trainer must navigate this by educating the client, advocating for best practices, and ensuring the chosen assessment aligns with current industry standards and the client's goals, all while maintaining a positive client relationship. Correct approach analysis. The correct approach prioritizes client safety, efficacy, and adherence to current professional standards. Utilizing a standardized, validated cardiovascular fitness assessment like the Rockport 1-mile walk test or a submaximal treadmill test is best professional practice. These assessments are widely recognized, have established protocols, and provide reliable data for program design. This aligns with the ethical responsibility of a certified personal trainer to use scientifically supported methods, ensuring the client receives an assessment that accurately reflects their current fitness level and allows for the development of an appropriate and safe training program. Regulatory frameworks for personal training certifications typically emphasize evidence-based practice and client well-being, which this approach upholds. Incorrect approaches analysis. One incorrect approach involves solely agreeing to the client's request for a specific, potentially outdated, assessment without critical evaluation. This fails to uphold the professional's duty of care and could lead to inaccurate fitness data, potentially resulting in an unsafe or ineffective training program. It also demonstrates a lack of professional judgment and a failure to advocate for best practices, which could be seen as a breach of ethical guidelines that mandate competence and the use of appropriate assessment tools. Another incorrect approach is to dismiss the client's request outright without explanation or offering alternatives. The trainer may believe their preferred method is superior. A complete dismissal can damage the client relationship and lead to dissatisfaction. Ethically, trainers should strive for clear communication and client education. Failing to explain the rationale behind assessment choices or to offer suitable alternatives can be perceived as unprofessional and unsupportive, potentially violating client-centered care principles. A third incorrect approach is to perform a non-standardized, ad hoc assessment that is not based on established protocols. This lacks scientific validity and reliability, making the results questionable for program design. It exposes the client to potential risks if the assessment does not accurately reflect their capabilities and fails to meet the professional standards expected of a certified trainer, potentially contravening guidelines that require assessments to be evidence-based and reproducible. Professional reasoning. When faced with a client-specific assessment request, a professional trainer should first understand the client's reasoning. Then, they should evaluate the requested assessment against current industry standards, scientific validity, and safety. If the requested assessment is not ideal, the trainer should clearly and respectfully explain why, referencing evidence-based practices and the potential limitations. They should then propose alternative, validated assessments that are appropriate for the client's goals and current fitness level, explaining the benefits of the proposed alternatives. This process ensures informed consent, promotes client education, and upholds professional integrity by prioritizing safe and effective training. Question 2. Benchmark analysis indicates that a client who has been training for 6 months with a personal trainer expresses a strong desire to incorporate a specific, advanced training technique they saw online, believing it will accelerate their strength gains. The trainer has assessed the client's current progress and believes this technique may not be appropriate for their current neuromuscular development stage and could increase injury risk. The trainer needs to decide how to respond to this client's request. Option A. Immediately agree to incorporate the advanced technique as requested by the client to maintain client satisfaction and avoid potential conflict. Option B. Explain the principles of neuromuscular adaptation, including motor unit recruitment and rate coding, and how the proposed technique might not align with the client's current physiological readiness. Then propose an alternative program that targets similar goals through scientifically validated methods. Option C. Politely dismiss the client's request, stating that the trainer's methods are superior and that the client should trust their expertise without question. Option D. Implement a modified version of the advanced technique, incorporating some elements of the client's request without a thorough explanation of its physiological implications or a clear rationale for the modifications. The correct answer is B. Explain the principles of neuromuscular adaptation, including motor unit recruitment and rate coding, and how the proposed technique might not align with the client's current physiological readiness. Then propose an alternative program that targets similar goals through scientifically validated methods. Explanation. Scenario analysis. This scenario presents a common challenge for personal trainers, balancing client expectations with evidence-based practice, particularly when a client requests a specific training modality without understanding its underlying physiological effects. The challenge lies in educating the client about neuromuscular adaptations and guiding them towards a program that aligns with their goals and physiological capabilities, rather than simply acquiescing to a potentially suboptimal or even unsafe request. The trainer must navigate the client's perceived expertise and potential resistance to alternative suggestions. Correct approach analysis. The correct approach involves a thorough assessment of the client's current fitness level, goals, and any pre-existing conditions. It then requires educating the client on the principles of neuromuscular adaptation, explaining how different training variables, intensity, volume, frequency, exercise selection, influence these adaptations, e.g., neural drive, motor unit recruitment, rate coding, intermuscular coordination, muscle hypertrophy. The trainer should then propose a program that is scientifically sound, tailored to the client's specific needs, and clearly articulates how it will achieve their desired outcomes, referencing established principles of exercise science. This aligns with the ethical obligation to provide safe and effective training, prioritizing client well-being and evidence-based practice over client demands that may be misinformed. It also upholds the professional standard of competence by demonstrating knowledge of physiological responses to training. Incorrect approaches analysis. One incorrect approach involves immediately agreeing to the client's specific, potentially misguided training request without further assessment or education. This fails to uphold the professional responsibility to ensure client safety and program efficacy. It could lead to ineffective training, plateaus, or even injury, violating the implicit contract of providing competent guidance. Ethically, it demonstrates a lack of professional judgment and a failure to act in the client's best interest. Another incorrect approach is to dismiss the client's request outright without explanation or offering alternatives. This can alienate the client, damage the trainer-client relationship, and fail to address the underlying reasons for the client's request. While the client's request may be flawed, a professional trainer should aim to educate and guide, not to be dismissive. This approach lacks the communication and client-centered skills expected of a certified professional. Third incorrect approach is to implement a generic program that superficially incorporates elements of the client's request, but lacks a clear rationale tied to neuromuscular adaptations. This demonstrates a superficial understanding of exercise physiology and a failure to apply principles effectively. It suggests the trainer is not fully engaging with the client's goals or the science behind training, potentially leading to suboptimal results and a lack of client trust. Professional reasoning. When faced with a client-specific training request, a personal trainer should employ a systematic decision-making process. First, actively listen to and understand the client's rationale behind their request. Second, conduct a comprehensive assessment to gather objective data on the client's current status and identify any contraindications. Third, leverage their knowledge of exercise physiology, specifically neuromuscular adaptations, to evaluate the scientific validity and potential effectiveness of the client's proposed approach. Fourth, engage in clear, evidence-based communication, educating the client on relevant physiological principles and explaining why a particular training strategy is recommended. Fifth, collaboratively develop a personalized program that addresses the client's goals while adhering to best practices for safety and efficacy. This process ensures that client autonomy is respected while prioritizing professional expertise and ethical obligations. Question 3. Cost-benefit analysis shows that incorporating functional fitness training for a client diagnosed with moderate osteoarthritis of the knee can significantly improve their quality of life and daily function. However, the trainer must carefully consider the potential risks of exacerbating joint pain and inflammation. Which of the following approaches best balances the potential benefits with the inherent risks for this client? Option A. Design a high-intensity interval training (HIIT) program to maximize calorie expenditure and cardiovascular benefits, assuming the client's desire for rapid results outweighs the risk of joint strain. Option B. Proceed with a standard strength and conditioning program, relying solely on the client's verbal feedback during each exercise to gauge their tolerance and adjust intensity as needed. Option C. Implement a program focusing on low-impact exercises, emphasizing proper form, gradual progression, and continuous monitoring of the client's response, with a clear plan for exercise modification or discontinuation if pain or discomfort arises. Option D. Advise the client that due to their diagnosed condition, it is too risky to engage in any form of functional fitness training and recommend they cease all exercise activities. The correct answer is C. Implement a program focusing on low-impact exercises, emphasizing proper form, gradual progression, and continuous monitoring of the client's response, with a clear plan for exercise modification or discontinuation if pain or discomfort arises. Explanation. Scenario analysis. This scenario presents a common challenge for personal trainers. A client with a pre-existing, diagnosed condition, osteoarthritis of the knee, seeking to improve functional fitness. The professional challenge lies in balancing the client's desire for progress with the inherent risks associated with their condition. A trainer must possess the knowledge to modify exercises safely, understand contraindications, and recognize when to refer to other healthcare professionals. The cost-benefit analysis in this context refers to the trainer's assessment of the potential benefits of exercise for the client's quality of life versus the potential risks of exacerbating their condition or causing new injuries. This requires a deep understanding of exercise physiology, biomechanics, and common pathologies. Correct approach analysis. The correct approach prioritizes client safety and evidence-based practice, aligning with the ethical and professional standards expected of a certified personal trainer. This involves a thorough pre-participation screening, including a detailed client history that specifically addresses the diagnosed condition, its severity, and any physician's recommendations or limitations. The trainer must then design a program that is individualized, focusing on low-impact exercises, proper form, and gradual progression. Crucially, this approach includes ongoing monitoring of the client's response to exercise, being prepared to modify or discontinue exercises that cause pain or discomfort, and maintaining open communication with the client about their symptoms. This aligns with the principle of do no harm and the professional responsibility to act within one's scope of practice, which includes understanding common injuries and conditions and how to safely train individuals with them. The Certified Personal Trainer Certification Framework emphasizes the importance of client assessment and program modification based on individual needs and limitations. Incorrect approaches analysis. One incorrect approach involves proceeding with a generic, high-intensity program without considering the client's diagnosed osteoarthritis. This fails to acknowledge the specific risks associated with knee joint degeneration, potentially leading to increased inflammation and further joint damage. Ethically, this violates the duty of care and the principle of do no harm. It also demonstrates a lack of professional competence in assessing and managing clients with common conditions, which is a core expectation of the certification. Another incorrect approach is to completely refuse to train the client due to their condition, without offering any alternatives or guidance. While caution is necessary, outright refusal without exploring safe modifications or recommending appropriate medical consultation can be seen as a failure to provide professional service within the scope of practice. A certified trainer should be able to identify safe exercise parameters for many common conditions or know when and how to refer. A third incorrect approach is to rely solely on the client's self-reported pain levels without understanding the underlying pathology or potential for delayed symptom onset. While client feedback is vital, a trainer must also possess the knowledge to interpret these signals in the context of the diagnosed condition and biomechanical principles. Ignoring the diagnosed condition and treating it as a generic client can lead to inappropriate exercise selection and potential injury. This demonstrates a lack of understanding of common injuries and conditions and their implications for exercise programming. Professional reasoning. When faced with a client with a diagnosed condition like osteoarthritis, a personal trainer should employ a systematic decision-making process. This begins with a comprehensive assessment, including a detailed health history and understanding any physician's clearance or recommendations. The trainer must then apply their knowledge of exercise science and common conditions to identify potential risks and benefits. The next step is to design an individualized program that prioritizes safety, focusing on appropriate exercise selection, intensity, and progression. Continuous monitoring of the client's response, open communication, and a willingness to modify the program are essential. Finally, the trainer must recognize the limits of their expertise and be prepared to refer the client to other healthcare professionals, e.g., physical therapist, physician, when necessary. This structured approach ensures that the client's well-being is paramount while still facilitating their fitness goals. Question 4. The risk matrix shows a potential for client misunderstanding regarding the physiological basis of exercise performance. A client, who has been researching fitness online, insists that to improve their muscular endurance for a specific sport, they need to focus on strengthening their smooth muscles, because they are more prevalent and responsible for sustained effort. They are asking you to design a training program that specifically targets this type of muscle for increased endurance. What is the most appropriate professional response? Option A. Agree with the client's premise and design a program that incorporates exercises intended to increase the strength and endurance of smooth muscles, as requested, to meet their perceived needs. Option B. Advise the client that to improve their smooth muscle endurance, they should consider consulting a specialist physician who can prescribe specific dietary supplements and advanced physiological interventions. Option C. Explain the distinct roles of skeletal, smooth, and cardiac muscle in the body, clarifying that skeletal muscles are primarily responsible for voluntary movement and power, while smooth muscles are involuntary and control internal organs, and cardiac muscle is responsible for the heart's function. Then, proceed to design a program focused on skeletal muscle endurance relevant to their sport. Option D. Politely dismiss the client's assertion about smooth muscle, stating it is incorrect without further explanation, and proceed with a standard endurance program for skeletal muscles. The correct answer is C. Explain the distinct roles of skeletal, smooth, and cardiac muscle in the body, clarifying that skeletal muscles are primarily responsible for voluntary movement and power, while smooth muscles are involuntary and control internal organs, and cardiac muscle is responsible for the heart's function. Then, proceed to design a program focused on skeletal muscle endurance relevant to their sport. Explanation. This scenario presents a professional challenge because it requires the personal trainer to balance a client's perceived needs with their own scope of practice and understanding of human physiology, specifically muscle types. The trainer must avoid making medical diagnoses or offering advice outside their expertise, which could lead to harm or misinformed decisions by the client. The ethical dilemma arises from the client's insistence on a specific, potentially misapplied, understanding of muscle function and its relation to their training goals. The correct approach represents best professional practice because it prioritizes client safety and education within the trainer's defined scope. By explaining the distinct roles of skeletal, smooth, and cardiac muscle in a way that is relevant to exercise and general health, the trainer empowers the client with accurate information without overstepping professional boundaries. This approach upholds the ethical principle of beneficence, acting in the client's best interest, and non-maleficence, avoiding harm, by preventing the client from pursuing ineffective or potentially harmful training strategies based on a misunderstanding. It also aligns with professional guidelines that emphasize evidence-based practice and client education. An incorrect approach that involves agreeing with the client's potentially flawed understanding of muscle types and their direct impact on specific exercise outcomes is ethically problematic. This could lead to the client engaging in training that is not optimized for their goals or, worse, could be detrimental if their understanding is based on misinformation that suggests unsafe practices. This failure to correct misinformation and guide the client towards scientifically sound principles violates the duty of care and could be seen as a breach of professional competence. Another incorrect approach, such as dismissing the client's concerns outright without providing an explanation, is also professionally unacceptable. While it avoids agreeing with misinformation, it fails to educate and build rapport. This can lead to client dissatisfaction, distrust, and a breakdown in the trainer-client relationship. Ethically, it neglects the opportunity to provide valuable, accurate information and guide the client towards a better understanding of their body. A further incorrect approach might involve the trainer attempting to provide a detailed physiological explanation that borders on medical advice, perhaps suggesting specific supplements or interventions related to muscle function. This oversteps the trainer's scope of practice and could lead to the client making health decisions based on unqualified advice, posing significant health risks and violating regulatory frameworks that define the boundaries of personal training. The professional decision-making process for similar situations should involve 1. Active listening. Understand the client's perspective and concerns fully. 2. Scope of practice assessment. Determine if the client's query falls within the trainer's expertise. 3. Evidence-based education. Provide accurate, clear, and concise information relevant to the client's question using appropriate analogies if helpful. 4. Redirection and referral. If the client's concerns extend beyond the trainer's scope, e.g., medical conditions, specific nutritional deficiencies, ethically refer them to appropriate healthcare professionals. 5. Client empowerment. Ensure the client understands the information provided and feels confident in their training plan. Question 5. The performance metrics show a consistent improvement in sprint times over the last 4 weeks, yet the client reports feeling significantly more fatigued during and after each session, struggling with recovery between sets. Based on the interplay of the ATPPC, glycolytic and oxidative energy systems, what is the most appropriate next step in program modification? Option A. Advise the client to simply rest more outside of training sessions without altering the current training protocol. Option B. Reduce the overall training volume by decreasing the number of sets and repetitions across all exercises. Option C. Increase the frequency and intensity of high-intensity interval training to further challenge the ATPPC and glycolytic systems. Option D. Introduce more aerobic conditioning to enhance the oxidative system's capacity for recovery and sustained effort. The correct answer is D. Introduce more aerobic conditioning to enhance the oxidative system's capacity for recovery and sustained effort. Explanation. Scenario analysis. This scenario presents a common challenge for personal trainers, interpreting performance data to inform program design. The client's subjective feedback, fatigue, conflicts with objective metrics, improve times, requiring the trainer to consider multiple physiological factors and client well-being beyond simple performance gains. The challenge lies in balancing the client's desire for continued improvement with the physiological demands placed on their energy systems, ensuring safety and long-term adherence. Correct approach analysis. The correct approach involves recognizing that the client's fatigue, despite improved performance, likely indicates a depletion of the ATPPC and glycolytic system's capacity to recover quickly between high-intensity efforts. This suggests a need to incorporate more aerobic conditioning to enhance oxidative system efficiency, which is crucial for recovery and sustained effort. This aligns with best professional practice by prioritizing the client's physiological recovery and overall health, preventing overtraining and potential injury, which are implicit ethical considerations in client care. It demonstrates a comprehensive understanding of energy system interplay and client adaptation. Incorrect approaches analysis. One incorrect approach would be to solely focus on further increasing the intensity or volume of anaerobic work, assuming the client can simply push through the fatigue. This ignores the physiological signals of overreaching and fails to address the underlying cause of the fatigue, potentially leading to burnout, injury, and a decline in performance. Ethically, this is a failure to adequately monitor client well-being and adapt programming based on their physiological response. Another incorrect approach would be to dismiss the client's subjective feedback and continue with the current training plan, attributing the fatigue to a lack of mental toughness. This disregards the client's lived experience and the physiological reality of energy system limitations. It represents a failure in communication and client-centered care, potentially damaging the trainer-client relationship and leading to non-adherence or injury. A third incorrect approach would be to drastically reduce training intensity without understanding the underlying physiological reason. While reducing intensity might alleviate fatigue, it doesn't address the need for improved recovery capacity. This approach lacks analytical depth and fails to optimize the training program for long-term progress. It is a missed opportunity to apply knowledge of energy systems effectively. Professional reasoning. When faced with conflicting performance data and client feedback, a professional trainer should first engage in active listening to understand the client's subjective experience. They should then analyze the performance metrics in the context of the client's training history and known physiological responses of the energy systems. The decision-making process should involve 1. Acknowledging and validating the client's feedback. 2. Hypothesizing potential physiological causes, e.g., insufficient recovery, over-reliance on specific energy systems. 3. Evaluating the current training program's impact on these systems. And 4. Proposing program modifications that address the identified issues while still aiming for performance goals. This iterative process ensures client safety, promotes adaptation, and fosters a strong professional relationship. Question 6. System analysis indicates a client who has been consistently progressing with their strength training program, reports experiencing intermittent tingling and numbness in their hands and feet during and after their workouts. They describe the sensation as pins and needles feeling that sometimes lingers for a few hours. They are eager to continue their training and have asked for advice on how to manage this. What is the most appropriate course of action for the certified personal trainer in this situation? Option A. Recommend the client consult with a physician or neurologist to investigate the cause of the tingling and numbness. Option B. Suggest specific nerve gliding exercises and stretches to alleviate the tingling and numbness. Option C. Continue with the planned workout program, as this may be a normal response to exertion and muscle fatigue. Option D. Advise the client to increase their water intake and try some light stretching to see if it resolves the issue. The correct answer is A. Recommend the client consult with a physician or neurologist to investigate the cause of the tingling and numbness. Explanation. Scenario analysis. This scenario presents a common challenge for personal trainers, identifying potential neurological issues that may impact a client's ability to perform exercises safely and effectively. The trainer must distinguish between normal fatigue and signs of a more serious underlying condition, requiring a keen understanding of the nervous system's role in motor control and sensation. Misinterpreting these signs could lead to inappropriate programming, client injury, or a failure to refer the client to appropriate medical professionals, all of which carry significant professional and ethical implications. Correct approach analysis. The correct approach involves recognizing the client's reported symptoms as potential indicators of a neurological issue and prioritizing client safety by recommending a medical evaluation. This aligns with the ethical responsibility of personal trainers to operate within their scope of practice. The Certified Personal Trainer Certification Framework emphasizes that trainers are not medical professionals and should not diagnose or treat medical conditions. Referring the client to a physician or neurologist is the most appropriate and ethically sound action, ensuring the client receives proper medical assessment and care. This upholds the principle of do no harm and demonstrates professional integrity by acknowledging the limits of one's expertise. Incorrect approach is analysis, recommending specific stretches or exercises to fix the tingling and numbness is a regulatory and ethical failure. This constitutes practicing outside the scope of a personal trainer, as it involves attempting to diagnose and treat a potential medical condition. It bypasses the necessary medical expertise required for such symptoms and could exacerbate the underlying issue or lead to further injury. Ignoring the symptoms and continuing with the planned workout is also a significant failure. This demonstrates a lack of attentiveness to client well-being and a disregard for potential safety concerns. It violates the ethical duty to prioritize client safety and could lead to adverse events, potentially resulting in liability for the trainer and the organization they represent. It also fails to acknowledge the potential impact of neurological issues on exercise performance and safety. Suggesting the client try over-the-counter pain relievers is another inappropriate action. This is a form of medical advice and treatment, which falls outside the personal trainer's scope of practice. It is a direct violation of regulatory guidelines that prohibit trainers from prescribing or recommending medication. The trainer should not be involved in managing a client's pain or symptoms through pharmacological means. Professional reasoning. When faced with a client reporting unusual sensory disturbances like tingling and numbness, a personal trainer should follow a structured decision-making process. First, listen attentively to the client's description of the symptoms, including onset, duration, and any aggravating or alleviating factors. Second, assess the immediate safety of continuing the planned exercise session. If there is any doubt about safety, modify or postpone the session. Third, recognize the limitations of the personal trainer's scope of practice. Symptoms like tingling and numbness are red flags that warrant medical attention. Fourth, professionally and empathetically recommend that the client consult with a qualified healthcare professional, such as a physician or neurologist, for proper diagnosis and treatment. Document the client's report and the recommendation made. Question 7. Compliance review shows a personal trainer is working with a client who has a history of patellofemoral pain syndrome. The trainer observes the client exhibiting knee valgus during squats and a tendency to allow their hips to rise faster than their shoulders during deadlifts. The trainer is considering how to address these biomechanical issues to improve the client's movement quality and reduce the risk of further knee discomfort. Which of the following approaches best addresses the biomechanical principles of human movement in this scenario? Option A. Focus on strengthening the gluteal muscles and improving hip external rotation to address the knee valgus, and cueing the client to maintain a neutral spine and drive through their heels during deadlift to promote better force transfer and hip extension. Option B. Advise the client to simply avoid deep squats and heavy deadlifts altogether, as these exercises are inherently risky for individuals with knee pain. Option C. Increase the weight on the squat and deadlift exercises to challenge the client's muscles and force them to adapt to the increased load, assuming the pain is just a sign of muscle fatigue. Option D. Immediately introduce plyometric exercises to improve the client's reactive strength and ability to absorb force, as this will indirectly help with knee stability. The correct answer is A. Focus on strengthening the gluteal muscles and improving hip external rotation to address the knee valgus, and cueing the client to maintain a neutral spine and drive through their heels during deadlifts to promote better force transfer and hip extension. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the personal trainer to interpret and apply biomechanical principles to a client's specific movement limitations, which are influenced by a pre-existing condition. The trainer must balance the client's desire for progress with the need to prevent exacerbation of their condition, demanding a nuanced understanding of movement mechanics and potential risks. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the client's safety and well-being, aligning with the ethical obligation to do no harm inherent in personal training certifications. It involves a thorough assessment of the client's current functional capacity and the biomechanical implications of their condition on specific movements. By identifying the underlying biomechanical inefficiencies, e.g., poor force transfer, excessive joint stress, and selecting exercises that mitigate these issues while still promoting strength and stability, the trainer acts responsibly. This approach is consistent with the general guidelines of personal training certifications, which emphasize individualized programming based on client assessment and the principles of safe and effective exercise prescription. Incorrect approaches analysis. One incorrect approach fails by overlooking the biomechanical implications of the client's condition, leading to potentially harmful exercise selection. This violates the ethical duty to assess and program appropriately for individual needs and limitations, potentially causing injury or worsening the existing condition. This could be seen as a failure to adhere to the fundamental principles of safe exercise programming expected of a certified professional. Another incorrect approach is to solely focus on the client's subjective experience without objectively assessing the biomechanical factors at play. While client feedback is important, ignoring objective biomechanical analysis can lead to continued inefficient or risky movement patterns, even if the client reports no immediate discomfort. This approach neglects the trainer's responsibility to provide expert guidance based on scientific principles. A further incorrect approach involves implementing complex or advanced exercises without first addressing the foundational biomechanical deficits. This can overload the client's system, leading to compensatory movements and increased risk of injury, directly contradicting the principle of progressive overload and safe progression. It demonstrates a lack of understanding of how to build a solid biomechanical foundation. Professional reasoning. Professionals should approach such situations by first conducting a comprehensive assessment that includes understanding the client's medical history and any limitations. This is followed by an objective evaluation of their movement patterns, identifying any biomechanical inefficiencies or risks. Based on this analysis, the trainer should then design a program that addresses these issues, prioritizes safety, and aligns with the client's goals. This involves selecting exercises that promote proper form, efficient force production, and minimize undue stress on joints and tissues, always considering the client's specific condition. Continuous monitoring and adjustment of the program based on client response and ongoing assessment are crucial. Question 8. Assessment of a client's cardiovascular response during a moderate-intensity aerobic session reveals a heart rate within the target zone. However, the client reports feeling unusually lightheaded and experiencing a significant increase in perceived exertion beyond what is typical for this intensity. What is the most appropriate course of action for the personal trainer? Option A. Continue the session as planned, reassuring the client that their heart rate is within the target zone and that perceived exertion can vary. Option B. Immediately stop the exercise session, assess the client's symptoms further, and advise them to consult with their physician if symptoms persist or worsen. Option C. Reduce the intensity of the exercise significantly and monitor the client closely for any changes in symptoms. Option D. Ask the client to rate their perceived exertion on a scale of 1-10 and continue the session if the rating is below 7. Correct answer is B. Immediately stop the exercise session, assess the client's symptoms further, and advise them to consult with their physician if symptoms persist or worsen. Explanation. This scenario presents a common challenge for personal trainers, interpreting subjective client feedback in the context of objective physiological responses. The professional's responsibility extends beyond simply observing heart rate. It involves understanding the client's overall experience and potential underlying factors affecting their cardiovascular response. The correct approach demonstrates best professional practice by prioritizing client safety and well-being, aligning with the ethical guidelines of personal training certifications, which emphasize client-centered care and the principle of do no harm. It involves a holistic assessment, considering both physiological data and subjective reporting, and making an informed decision based on a comprehensive understanding of the client's condition. This aligns with the implicit regulatory framework of ensuring client safety and competence in service delivery. Incorrect approaches fail to meet professional standards. One incorrect approach might involve solely relying on numerical data without considering the client's subjective experience, potentially leading to overexertion or underestimation of risk. This could be seen as a failure to exercise due diligence and a lack of client-centered assessment, which are fundamental ethical obligations. Another incorrect approach might be to dismiss the client's subjective feedback, which disregards their autonomy and can erode trust, violating ethical principles of respect and communication. A further incorrect approach could be to immediately cease all activity without further investigation, which, while prioritizing safety, might be an overreaction and not the most effective or appropriate course of action for the client's long-term training goals, potentially indicating a lack of nuanced professional judgment. Professionals should employ a decision-making process that involves 1. Active listening and empathy to understand the client's subjective experience. 2. Objective data collection and interpretation, e.g., heart rate, perceived exertion. 3. Consideration of the client's medical history and any contraindications. 4. Collaborative decision-making with the client regarding modifications or cessation of activity. 5. Documentation of observations and decisions. This systematic approach ensures that client safety is paramount, while also facilitating effective and appropriate training. Question 9. Comparative studies suggest that the type of carbohydrate consumed significantly impacts energy levels and recovery. A client asks you, their certified personal trainer, for advice on how to best utilize carbohydrates to support their training goals. Considering the different types of carbohydrates and their functions, which of the following represents the most appropriate and ethically sound guidance you can provide within your scope of practice? Option A. Educate the client on the general roles of simple and complex carbohydrates in providing energy and discuss common food sources for each, emphasizing that a balanced intake from various sources supports overall health and performance. Option B. Explain that complex carbohydrates are less important than protein for post-workout recovery and suggest focusing solely on protein intake after exercise. Option C. Recommend that the client eliminate all simple carbohydrates from their diet to prevent energy crashes and promote fat loss. Option D. Advise the client to consume a large portion of simple carbohydrates immediately before each workout to maximize immediate energy availability. The correct answer is A. Educate the client on the general roles of simple and complex carbohydrates in providing energy and discuss common food sources for each, emphasizing that a balanced intake from various sources supports overall health and performance. Explanation. Scenario analysis. This scenario presents a common challenge for personal trainers, advising clients on dietary strategies that align with their fitness goals while navigating the complexities of carbohydrate types and their physiological effects. The challenge lies in translating scientific understanding into practical, client-appropriate advice without overstepping the scope of practice or providing potentially harmful misinformation. A trainer must consider individual client needs, the scientific evidence, and ethical boundaries. Correct approach analysis. The correct approach demonstrates best professional practice by focusing on educating the client about the general roles of different carbohydrate types and their common dietary sources, empowering them to make informed choices. This aligns with the ethical responsibility of a personal trainer to provide evidence-based guidance within their scope of practice. It avoids making specific meal plans or prescriptive dietary recommendations, which typically fall under the purview of a registered dietitian or nutritionist. This approach respects professional boundaries and prioritizes client safety and autonomy. Incorrect approaches analysis. One incorrect approach involves recommending specific quantities of simple carbohydrates for pre-workout energy without considering the client's overall dietary pattern, individual metabolic response, or potential for blood sugar fluctuations. This could lead to suboptimal performance or adverse health effects and represents a failure to provide holistic, individualized advice. It also borders on prescriptive dietary advice, which is outside the scope of a personal trainer. Another incorrect approach is to dismiss the importance of complex carbohydrates for sustained energy, suggesting they are less relevant than protein for muscle recovery. This is a misrepresentation of nutritional science, as complex carbohydrates are crucial for replenishing glycogen stores, which directly impacts recovery and future performance. Such advice could lead to an imbalanced diet and hinder the client's progress. A further incorrect approach is to advise the client to completely eliminate all simple carbohydrates from their diet, citing them as inherently bad. This is an overly simplistic and potentially unhealthy recommendation. While excessive intake of refined simple sugars can be detrimental, some simple carbohydrates are found in nutrient-dense foods like fruits and dairy and play a role in energy provision. This approach demonstrates a lack of nuanced understanding of carbohydrate metabolism and dietary balance. Professional reasoning. When faced with client inquiries about nutrition, a personal trainer should first assess the client's current knowledge and goals. The trainer should then provide general, evidence-based information about macronutrients, including the different types of carbohydrates, their functions, and common food sources. The trainer should emphasize the importance of a balanced diet and encourage the client to consult with a registered dietitian or nutritionist for personalized meal planning and specific dietary recommendations. The trainer's role is to educate and empower, not to prescribe. Question 10. Strategic planning requires a personal trainer to consider how a client's reported symptoms might relate to fundamental physiological processes. A client mentions experiencing intermittent tingling and numbness in their extremities, particularly after prolonged periods of sitting. The trainer knows that blood circulation pathways are vital for delivering oxygen and nutrients throughout the body and removing waste products. Considering the client's reported symptoms and the trainer's knowledge of circulation, what is the most appropriate and professionally responsible course of action? Option A. Advise the client to consult with a physician for a proper diagnosis of their symptoms, as these could indicate a circulatory issue requiring medical attention. Option B. Suggest the client try elevating their legs for extended periods and drinking more water, as these are general remedies for circulation issues. Option C. Reassure the client that these symptoms are common and likely due to fatigue or minor nerve compression, and continue with the planned training session as usual. Option D. Immediately design a series of exercises specifically aimed at increasing blood flow to the extremities, assuming the symptoms are due to poor circulation. The correct answer is A. Advise the client to consult with a physician for a proper diagnosis of their symptoms, as these could indicate a circulatory issue requiring medical attention. Explanation. Scenario analysis. This scenario presents a professional challenge because a personal trainer must interpret and apply knowledge of human physiology, specifically blood circulation, to a client's reported symptoms. Misinterpreting these symptoms could lead to inappropriate exercise prescription, potentially exacerbating the client's condition or causing harm. The trainer's responsibility extends beyond simply designing workouts. It includes a duty of care to understand basic physiological responses and when to refer to medical professionals. Correct approach analysis. The correct approach demonstrates best professional practice by recognizing the limitations of a personal trainer's scope of practice. A personal trainer is not qualified to diagnose medical conditions. Therefore, advising the client to consult a physician for a proper diagnosis of their symptoms, which could be indicative of circulatory issues, is the ethically and professionally sound action. This aligns with the general ethical guidelines for personal trainers to operate within their expertise and refer clients to appropriate healthcare providers when necessary. This proactive referral ensures the client receives accurate medical assessment and treatment, safeguarding their health and well-being. Incorrect approach is analysis. One incorrect approach involves attempting to diagnose the client's symptoms based on general knowledge of blood circulation pathways. This is a regulatory and ethical failure because it constitutes practicing outside the scope of a personal trainer's certification and expertise. Personal trainers are not licensed medical professionals and are not trained or permitted to diagnose medical conditions. This could lead to misdiagnosis, delayed proper medical care, and potential harm to the client, violating the trainer's duty of care. Another incorrect approach is to dismiss the client's symptoms as insignificant or unrelated to circulation without further investigation or professional consultation. This is an ethical failure, as it neglects the client's reported concerns and fails to uphold the duty of care. Ignoring potential signs of circulatory problems could have serious health consequences for the client, and a responsible professional would not disregard such information. A third incorrect approach might be to immediately prescribe specific exercises designed to improve circulation without a medical diagnosis. This is a significant regulatory and ethical failure. While exercise can impact circulation, doing so without understanding the underlying cause of the client's symptoms is dangerous. The prescribed exercises could be contraindicated for the actual medical condition, leading to adverse effects or worsening the client's health. This action oversteps the trainer's scope and demonstrates a lack of professional judgment. Professional reasoning. When faced with a client reporting symptoms that could indicate a medical issue, especially one related to vital bodily systems like circulation, a personal trainer must employ a decision-making process rooted in safety, ethics, and scope of practice. The process involves 1. Active listening and information gathering. Understand the client's reported symptoms clearly. 2. Scope of practice assessment. Determine if the reported symptoms fall within the trainer's expertise or require medical referral. 3. Risk assessment. Evaluate the potential risks of providing exercise advice without a diagnosis. 4. Referral protocol. Initiate a referral to a qualified healthcare professional when symptoms suggest a medical condition. 5. Documentation. Record the client's report and the action taken. E.g. referral. This systematic approach ensures client safety and upholds professional integrity. Question 11. To address the challenge of designing a safe and effective exercise program for a client experiencing lower back pain during certain movements, which of the following strategies best prioritizes the strengthening of key stabilizing muscle groups to support spinal health while minimizing risk? Option A. Incorporate exercises that involve significant spinal flexion and extension, such as traditional crunches and hyperextension, to directly target abdominal and back muscles. Option B. Focus on compound lower body exercises like squats and deadlifts to build overall leg strength, assuming this will indirectly support the back. Option C. Exclude all exercises that involve the lower body and core, concentrating solely on upper body isolation exercises to avoid any potential strain on the back. Option D. Implement a program that emphasizes core stabilization, exercises such as planks and bird dogs, alongside gluteal strengthening movements like glute bridges, while carefully monitoring for any pain exacerbation. The correct answer is B. Focus on compound lower body exercises like squats and deadlifts to build overall leg strength, assuming this will indirectly support the back. Explanation. Scenario analysis. A personal trainer is designing a program for a new client who reports experiencing lower back pain during certain movements. The challenge lies in selecting exercises that effectively target major muscle groups for overall fitness, while simultaneously avoiding exacerbation of the client's existing pain. This requires a nuanced understanding of muscle group function and biomechanics to ensure safety and efficacy, preventing potential injury and maintaining client trust. Correct approach analysis. The correct approach involves prioritizing exercises that strengthen the core musculature, transverse abdominis, multifidus, obliques, and the gluteal complex, gluteus maximus, medius minimus. These muscle groups are crucial for spinal stability and pelvic alignment. Strengthening them can help alleviate pressure on the lower back. For instance, exercises like planks, bird dogs, and glute bridges, when performed with proper form, engage these stabilizers without excessive spinal flexion or extension. This aligns with the ethical responsibility of a personal trainer to prioritize client safety and well-being, adhering to the principle of do no harm inherent in professional practice. It also reflects a competent application of knowledge regarding the functional anatomy of major muscle groups. Incorrect approaches analysis. One incorrect approach would be to focus solely on exercises that target the quadriceps and hamstrings with heavy compound lifts like squats and deadlifts, without adequately assessing or addressing the client's lower back pain. This fails to consider the kinetic chain and how weakness or imbalance in the core and glutes can contribute to lower back issues. Ethically, this demonstrates a lack of due diligence and a disregard for the client's reported condition, potentially leading to injury and violating the trainer's duty of care. Another incorrect approach would be to avoid all lower body and core exercises, opting instead for upper body isolation movements like bicep curls and triceps extensions. While these exercises do not directly impact the lower back, they neglect the development of major muscle groups essential for overall functional fitness and do not address the underlying biomechanical issues that may be contributing to the client's pain. This represents a failure to provide a comprehensive and effective training program, falling short of professional standards. A third incorrect approach would be to recommend exercises that involve significant spinal flexion or extension, such as traditional crunches or hyperextensions, without proper modification or assessment. These movements can place undue stress on the lumbar spine, especially in an individual already experiencing pain. This demonstrates a lack of understanding of exercise contraindications and a failure to apply knowledge of muscle group function in a safe and appropriate manner, posing a direct risk to the client. Professional reasoning. When faced with a client reporting pain, a personal trainer must adopt a systematic and client-centered approach. This involves thorough assessment, active listening to the client's concerns, and a deep understanding of exercise physiology and biomechanics. The decision-making process should prioritize safety, followed by efficacy. This means selecting exercises that are appropriate for the client's current condition, progressively building strength and stability in the relevant muscle groups, and continuously monitoring the client's response. If pain is present, modifications or alternative exercises should be readily available and implemented. This process ensures that the trainer is acting within their scope of practice and upholding their ethical obligations to the client. Question 12. Stakeholder feedback indicates that some clients express a belief that they can activate specific muscle fibers more than others during a workout to achieve targeted hypertrophy, often referencing anecdotal methods they've heard about. A new client, who has been researching online, asks you to explain how their muscles actually contract to build size and strength, specifically questioning if they can consciously force certain fibers to work harder than others to maximize growth in a particular area. Which of the following approaches best addresses the client's inquiry while adhering to the principles of evidence-based practice and professional scope for a certified personal trainer? Option A. Provide a detailed explanation of the biochemical processes involved in ATP hydrolysis and calcium ion release, using highly technical terminology to impress the client with your advanced knowledge. Option B. State that the concept of selectively activating specific muscle fibers is too complex for a personal trainer to explain, and that they should consult a physiologist for such detailed information. Option C. Explain the sliding filament theory, detailing how actin and myosin filaments interact to cause muscle shortening, and discuss motor unit recruitment, emphasizing that the nervous system recruits motor units based on the intensity of the contraction, with higher intensity leading to the recruitment of more and larger motor units, thereby influencing the overall force production and potential for hypertrophy. Option D. Agree with the client that they can indeed force specific fibers to work harder through mental focus and visualization techniques, as this is a common strategy discussed in advanced training circles. Correct answer is C. Explain the sliding filament theory, detailing how actin and myosin filaments interact to cause muscle shortening, and discuss motor unit recruitment, emphasizing that the nervous system recruits motor units based on the intensity of the contraction, with higher intensity leading to the recruitment of more and larger motor units, thereby influencing the overall force production and potential for hypertrophy. Explanation. Scenario analysis. This scenario presents a common challenge where a client expresses a desire to achieve a specific physical outcome based on anecdotal evidence or a misunderstanding of physiological principles. The professional's role is to bridge the gap between the client's perception and the scientific reality of muscle function, ensuring safe and effective training. The challenge lies in educating the client without dismissing their goals or creating undue anxiety, while adhering to the scope of practice and evidence-based guidelines relevant to personal training certification. Correct approach analysis. The correct approach involves accurately explaining the sliding filament theory and the concept of motor unit recruitment. This demonstrates a commitment to evidence-based practice, a core tenet of professional personal training. By detailing how muscle fibers shorten and how different motor units are activated based on the intensity of the contraction, the trainer provides a scientifically sound rationale for the training program. This approach aligns with the ethical obligation to provide accurate information and to train clients within the established scientific understanding of human physiology, as expected by the Certified Personal Trainer Certification Framework. It empowers the client with knowledge, fostering trust and adherence to a program designed for optimal results and safety. Incorrect approaches analysis. One incorrect approach involves simply agreeing with the client's assertion without providing any scientific explanation. This fails to uphold the professional responsibility to educate and can lead to the client pursuing ineffective or potentially harmful training strategies based on misinformation. It also bypasses the opportunity to build credibility through knowledge, potentially violating ethical guidelines related to professional competence and client well-being. Another incorrect approach is to dismiss the client's goal as impossible without offering a constructive alternative or explanation. This can damage the client-trainer relationship, leading to frustration and a lack of trust. Ethically, it demonstrates poor communication and a failure to meet the client's needs in a supportive manner, which is contrary to the principles of client-centered care expected within the personal training profession. A further incorrect approach is to introduce complex physiological concepts beyond the scope of a personal trainer's certification or the client's comprehension level, using jargon without clear explanation. While attempting to be thorough, this can overwhelm and confuse the client, hindering their understanding and engagement. It risks misrepresenting the trainer's expertise and failing to effectively communicate the necessary information for safe and effective training, potentially contravening guidelines on clear and accessible client communication. Professional reasoning. Professionals should first actively listen to the client's concerns and goals. Then, they should assess the client's current understanding of exercise physiology. The next step is to provide clear, concise, and scientifically accurate explanations tailored to the client's level of comprehension, using analogies where appropriate. This should be followed by a discussion of how the training program will leverage these physiological principles to achieve the client's goals safely and effectively. Finally, the trainer should encourage questions and confirm the client's understanding, ensuring a collaborative and informed approach to training. Question 13. Stakeholder feedback indicates that some clients believe their personal trainer can definitively assess and manage their cardiovascular health based solely on exercise performance and perceived exertion, sometimes questioning the need for medical checkups. As a certified personal trainer, how should you respond to a client who expresses this belief and asks if you can confirm their cardiovascular health is improving solely through your training sessions? Option A. Provide specific dietary recommendations and suggest certain supplements that are known to improve heart health, implying these will negate the need for medical evaluation. Option B. Advise the client to significantly increase the intensity and duration of their workouts to rapidly improve their cardiovascular markers, suggesting they can forego a doctor's visit. Option C. Explain that while exercise is crucial for cardiovascular health, definitive assessment and management of any underlying conditions require consultation with a healthcare professional, and you will work collaboratively with their medical advice to optimize their fitness program. Option D. Assure the client that your expertise in exercise physiology is sufficient to monitor their cardiovascular health and that continued training with you will resolve any potential issues. The correct answer is C. Explain that while exercise is crucial for cardiovascular health, definitive assessment and management of any underlying conditions require consultation with a healthcare professional, and you will work collaboratively with their medical advice to optimize their fitness program. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a personal trainer to balance client-driven desires with evidence-based practice and regulatory compliance concerning health recommendations. The client's perception of their cardiovascular health, influenced by anecdotal evidence or personal beliefs, may not align with objective physiological responses or established health guidelines. A personal trainer must navigate this by prioritizing client safety and well-being, adhering to their scope of practice, and understanding the limitations of their role in providing medical advice. The challenge lies in educating the client effectively without overstepping professional boundaries or making unsubstantiated claims. Correct approach analysis. The correct approach emphasizes the personal trainer's role in facilitating informed decision-making based on established exercise science principles and the client's individual response to exercise, while respecting the need for medical consultation. This aligns with the ethical and regulatory framework for personal trainers, which mandates acting within one's scope of practice and prioritizing client safety. By recommending a consultation with a healthcare professional for definitive diagnosis and management of potential cardiovascular issues, the trainer upholds their responsibility to refer when a situation exceeds their expertise. This approach ensures the client receives appropriate medical guidance, which is crucial for managing cardiovascular health, and protects the trainer from liability by not providing medical advice. It also fosters a collaborative approach to client care, integrating professional fitness guidance with medical oversight. Incorrect approaches analysis. One incorrect approach involves dismissing the client's concerns outright and proceeding with a standard program without further investigation. This fails to acknowledge the client's subjective experience and potential underlying health issues, which could lead to an unsafe training environment. Ethically, it demonstrates a lack of client-centered care and a disregard for potential health risks. Another incorrect approach is to provide specific dietary or medical advice to manage the client's perceived cardiovascular condition. This directly violates the scope of practice for a personal trainer, as it encroaches upon the domain of registered dietitians and medical doctors. Regulatory frameworks for personal trainers strictly prohibit the provision of medical diagnoses or treatment plans. Such an action could result in disciplinary action, loss of certification, and legal repercussions. A third incorrect approach is to overstate the immediate benefits of exercise in curing or definitively resolving cardiovascular issues without medical confirmation. While exercise is beneficial for cardiovascular health, presenting it as a sole or immediate solution without acknowledging the need for medical evaluation and management is misleading and potentially dangerous. This misrepresents the role of exercise and can create false expectations, delaying necessary medical intervention. Professional reasoning. Professionals should adopt a decision-making process that begins with active listening to the client's concerns. This should be followed by an assessment of the client's current fitness level and any reported symptoms, always within the scope of a personal trainer. If any concerns arise that suggest a potential underlying medical condition, especially related to cardiovascular health, the immediate and primary step is to recommend consultation with a qualified healthcare provider. The trainer's role is to support the client's fitness journey within safe parameters and in conjunction with medical advice, not to diagnose or treat medical conditions. This involves clear communication, setting appropriate expectations, and maintaining professional boundaries. Question 14. Operational review demonstrates a client reporting significant shortness of breath and chest tightness during a moderate-intensity warm-up, stating they have experienced this intermittently for the past week. The personal trainer is aware of the client's general fitness goals, but has no specific medical history beyond standard intake forms. What is the most appropriate immediate course of action for the personal trainer? Option A. Suggest breathing exercises and relaxation techniques to help the client manage their perceived shortness of breath. Option B. Immediately stop the session, inquire further about the duration and severity of the symptoms, and strongly recommend the client seek medical evaluation from a physician. Option C. Continue with the planned workout, assuming the symptoms are due to deconditioning and will improve with consistent training. Option D. Advise the client to rest and hydrate, then suggest they try to push through the discomfort to build respiratory endurance. The correct answer is D. Advise the client to rest and hydrate, then suggest they try to push through the discomfort to build respiratory endurance. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a personal trainer to assess a client's respiratory health without being a medical professional. The trainer must recognize the limits of their scope of practice while still providing safe and effective guidance. Misinterpreting symptoms or overstepping professional boundaries could lead to harm or legal repercussions. Correct approach analysis. The correct approach involves recognizing the potential seriousness of the client's symptoms and referring them to a qualified healthcare provider. This aligns with the ethical and regulatory framework for personal trainers, which mandates prioritizing client safety and operating within one's scope of practice. Referring to a physician ensures the client receives appropriate medical evaluation and diagnosis, which is beyond the trainer's expertise. This upholds the principle of do no harm and demonstrates responsible professional conduct. Incorrect approach is analysis. One incorrect approach is to dismiss the client's symptoms as minor or unrelated to breathing. This is a failure to conduct a proper risk assessment and could lead to a delay in necessary medical attention, potentially exacerbating a serious underlying condition. Ethically, this demonstrates a lack of due diligence and a disregard for client well-being. Another incorrect approach is to attempt to diagnose or treat the respiratory issue. This directly violates the scope of practice for a personal trainer, as it encroaches upon the domain of licensed medical professionals. Such an action could result in incorrect advice, ineffective treatment, and potential harm to the client, leading to liability for the trainer. A third incorrect approach is to continue with a high-intensity workout despite the client's reported breathing difficulties. This ignores clear warning signs and prioritizes workout completion over client safety. It demonstrates a lack of understanding of exercise physiology and the potential impact of compromised respiratory function on exercise performance and safety. This could lead to acute respiratory distress or other adverse events. Professional reasoning. When faced with a client exhibiting symptoms that could indicate a medical condition, a personal trainer should follow a structured decision-making process. First, acknowledge and validate the client's reported symptoms. Second, assess the immediate safety of the situation. If symptoms are severe or acute, immediate cessation of activity and emergency services may be warranted. Third, determine if the symptoms fall within the trainer's scope of practice to address. In this case, respiratory distress clearly does not. Fourth, if the symptoms suggest a potential medical issue, the professional and ethical course of action is to refer the client to a qualified healthcare provider for diagnosis and treatment. Documenting the client's report and the referral is also crucial. Question 15. Consider a scenario where a client consistently demonstrates a knee valgus collapse, knees caving inward during a bodyweight squat. Which of the following analytical approaches best reflects a systematic and effective strategy for addressing this movement pattern? Option A. Recommending that the client simply push their knees out during the squat and increasing the weight to force better form. Option B. Focusing on strengthening the quadriceps muscles through isolation exercises like leg extensions. Option C. Implementing a series of glute activation exercises and prescribing increased squat volume to build strength. Option D. Performing a detailed assessment of hip abduction and external rotation strength, ankle dorsiflexion mobility, and observing the client's foot pronation during the squat. The correct answer is C. Implementing a series of glute activation exercises and prescribing increased squat volume to build strength. Explanation. This scenario presents a common challenge for personal trainers, assessing and correcting movement patterns that may predispose a client to injury or limit performance. The professional challenge lies in accurately identifying the root cause of the observed movement dysfunction and selecting the most appropriate intervention. A trainer must possess a strong understanding of biomechanics and common movement deviations to effectively guide a client. The correct approach involves a systematic analysis of the client's movement, identifying deviations from ideal mechanics, and then selecting corrective exercises that directly address the identified issues. This aligns with the ethical and professional responsibility of a certified personal trainer to provide safe and effective programming. Best professional practice dictates a thorough assessment before intervention, ensuring that corrective strategies are targeted and evidence-based. This approach minimizes the risk of exacerbating existing issues or creating new ones, thereby upholding the trainer's duty of care. An incorrect approach would be to immediately implement a generic corrective exercise program without a specific assessment of the client's movement patterns. This fails to address the individual's unique biomechanical limitations and could lead to ineffective training or even harm. Another incorrect approach is to focus solely on strengthening muscles that appear weak without understanding how they contribute to the overall movement pattern. This overlooks potential mobility restrictions or faulty neuromuscular control that might be the primary driver of the dysfunction. A further incorrect approach is to assume the client's pain or discomfort is solely due to muscle imbalance and to prescribe exercises without considering other potential contributing factors such as joint health or neurological issues. These approaches demonstrate a lack of thorough assessment and a failure to apply a client-centered, evidence-based methodology, potentially violating professional standards of practice by not acting in the client's best interest. The professional decision-making process should involve 1. Conducting a comprehensive movement assessment to identify specific deviations. 2. Analyzing the potential causes of these deviations, considering mobility, stability, and neuromuscular control. 3. Selecting targeted corrective exercises that address the identified root causes. 4. Progressing the client systematically, monitoring for improvements and adjusting the program as needed. 5. Maintaining clear communication with the client regarding the assessment findings and the rationale behind the chosen interventions. Question 16. The investigation demonstrates that a client reports feeling significantly less breathless during their usual cardiovascular exercise sessions compared to when they started their training program. They describe their breathing as easier and more controlled. Considering the physiological impact of consistent exercise on the respiratory system, which of the following explanations best aligns with the scope of practice for a certified personal trainer and promotes client well-being? Option A. The client's improved breathing is a direct result of the exercise program curing their underlying respiratory condition, allowing for normal lung function. Option B. The client is likely experiencing a placebo effect, and their perception of easier breathing is not a true physiological change. Option C. The exercise program has likely enhanced the efficiency of the client's respiratory muscles, leading to improved tidal volume and a reduced sense of perceived exertion during activity. Option D. The exercise program has stimulated the client's lungs to grow larger, significantly increasing their overall lung capacity. Correct answer is C. The exercise program has likely enhanced the efficiency of the client's respiratory muscles, leading to improved tidal volume and a reduced sense of perceived exertion during activity. Explanation. Scenario analysis. This scenario presents a common challenge for personal trainers, where a client reports subjective improvements in breathing during exercise. The trainer must interpret this feedback within the context of established physiological principles and client safety, avoiding overstatement or misinterpretation of potential benefits. The challenge lies in distinguishing between normal physiological adaptations to exercise and potential underlying medical conditions, necessitating a cautious and evidence-based approach. Correct approach analysis. The correct approach emphasizes the role of exercise in improving respiratory muscle strength and efficiency, leading to enhanced tidal volume and reduced perceived exertion during physical activity. This aligns with the scope of practice for a certified personal trainer, which includes understanding the physiological effects of exercise. It also reflects best professional practice by acknowledging the client's subjective experience while grounding the explanation in established exercise science principles without making medical claims. This approach respects the client's feedback and provides a relevant, non-medical explanation for their perceived improvement. Incorrect approach is analysis. One incorrect approach involves attributing the client's improved breathing directly to a cure for a respiratory condition. This is a significant regulatory and ethical failure as it constitutes practicing medicine without a license, a violation of most personal training certification standards, and potentially state or national laws. Certified personal trainers are not qualified to diagnose or treat medical conditions. Another incorrect approach is to dismiss the client's subjective experience entirely, suggesting it is merely a placebo effect or insignificant. This fails to acknowledge the client's perception and can damage the trainer-client relationship. Ethically, it demonstrates a lack of empathy and attentiveness to client feedback. While not a direct regulatory violation in itself, it falls short of professional client care standards. A third incorrect approach is to recommend specific breathing exercises or techniques that are typically prescribed for medical conditions without consulting a qualified healthcare professional. This again borders on practicing medicine without a license and could be harmful if the client has an undiagnosed or improperly managed respiratory issue. It violates the principle of working within one's scope of practice. Professional reasoning. When faced with a client reporting subjective improvements in respiratory function during exercise, a personal trainer should first acknowledge and validate the client's experience. They should then provide an explanation based on general physiological adaptations to exercise, such as improved respiratory muscle strength and efficiency, which can lead to easier breathing during activity. Crucially, the trainer must avoid making any medical claims or diagnoses. If the client expresses concerns about their respiratory health or reports significant changes, the trainer's primary responsibility is to recommend that the client consult with a qualified healthcare professional, such as a physician or respiratory therapist, for proper evaluation and guidance. This decision-making process prioritizes client safety, adheres to the trainer's scope of practice, and upholds ethical standards by deferring medical matters to appropriate professionals. Question 17. Upon reviewing a client's session notes, you observe that after performing a series of compound strength exercises, the client reported experiencing significant shakiness in their limbs for several minutes post-exercise, which they described as feeling unstable. Considering the role of the nervous system in movement and fatigue, which of the following approaches best addresses this client's feedback and ensures a safe and effective training program? Option A. Acknowledge the client's subjective experience, gather more specific details about the shakiness, consider potential neuromuscular fatigue or central nervous system overstimulation as contributing factors, and adjust the subsequent exercises or rest periods accordingly. Option B. Assume the shakiness is a normal physiological response to intense exercise and continue with the planned program, reassuring the client that this is expected. Option C. Investigate the client's hydration and nutritional intake immediately, as these are common causes of post-exercise fatigue and instability. Option D. Immediately discontinue all exercises that involve similar movement patterns or muscle groups and implement a significantly reduced intensity for the remainder of the session. The correct answer is C. Investigate the client's hydration and nutritional intake immediately, as these are common causes of post-exercise fatigue and instability. Explanation. Scenario analysis. This scenario presents a common challenge for personal trainers, interpreting client feedback and translating it into effective training adjustments. The client's subjective experience of shakiness after a specific exercise requires the trainer to move beyond simply observing physical performance. It necessitates an understanding of the nervous system's role in motor control and fatigue, and how to differentiate between normal physiological responses and potential issues requiring intervention. The challenge lies in accurately assessing the cause of the shakiness and determining the appropriate course of action without overreacting or dismissing the client's concerns. Correct approach analysis. The correct approach involves a systematic assessment that prioritizes client safety and evidence-based practice, aligning with the core principles of professional conduct for certified personal trainers. This approach demonstrates a commitment to understanding the underlying physiological mechanisms of movement and fatigue, specifically the role of the nervous system. By considering factors like neuromuscular fatigue, proprioceptive feedback, and the potential for overstimulation. The trainer is acting within their scope of practice to identify potential causes of the client's reported symptom. This aligns with the ethical obligation to provide safe and effective training programs and the regulatory expectation to base programming on sound physiological principles. The trainer's actions of gathering more information, considering differential diagnoses within their scope, and adjusting the program reflect a responsible and client-centered methodology and correct approaches analysis. Dismissing the client's feedback as simply normal fatigue without further investigation is a failure to acknowledge the client's subjective experience and a potential lapse in professional diligence. This approach neglects the possibility that the shakiness could indicate a more significant issue, such as excessive neuromuscular fatigue or an adverse reaction to the exercise, which could compromise safety and hinder progress. It also fails to uphold the ethical duty to listen to and address client concerns. Immediately stopping all similar exercises and making drastic program changes without a thorough assessment is an overreaction. While client safety is paramount, such a response might be unnecessary and could limit the client's potential gains if the shakiness was a transient or minor physiological response. This approach lacks a systematic, evidence-based decision-making process and could lead to suboptimal programming. Focusing solely on external factors like diet or sleep, without considering the immediate physiological response to the exercise itself, is an incomplete assessment. While these factors are important for overall recovery and performance, they do not directly address the client's report of shakiness immediately post-exercise, which points to a more direct neuromuscular or central nervous system involvement. This approach fails to connect the client's specific symptom to the training stimulus. Professional reasoning. When faced with a client reporting unusual sensations like shakiness post-exercise, a personal trainer should employ a structured decision-making process. This begins with active listening and acknowledging the client's feedback. Next, the trainer must gather more specific information about the sensation, when it occurred, its duration, intensity, and any associated symptoms. Simultaneously, the trainer should consider the physiological context, drawing upon their knowledge of the nervous system's role in movement, including motor unit recruitment, proprioception, and central fatigue. This allows for a differential diagnosis within the scope of practice, distinguishing between normal physiological responses and potential red flags. Based on this assessment, the trainer can then make informed decisions about program modifications, such as adjusting exercise intensity, volume, rest periods, or exercise selection, always prioritizing client safety and progress. If the symptoms suggest a condition beyond the trainer's scope, referral to a qualified healthcare professional is the appropriate next step. Question 18. The evaluation methodology shows a client reporting sharp, localized pain in their knee during the eccentric phase of a squat. The trainer observes no visible swelling or deformity. What is the most appropriate immediate course of action for the certified personal trainer? Option A. Immediately cease the squat exercise, inquire further about the pain's characteristics, and consider modifying or substituting the exercise based on the client's responses. Option B. Instruct the client to continue with the squat, but to reduce the range of motion to avoid the painful area. Option C. Stop all lower body exercises for the remainder of the session and recommend complete rest for the knee. Option D. Advise the client to push through the pain as it is likely just muscle fatigue. The correct answer is A. Immediately cease the squat exercise, inquire further about the pain's characteristics, and consider modifying or substituting the exercise based on the client's responses. Explanation. Scenario analysis. This scenario presents a common challenge for personal trainers, interpreting client-reported symptoms and determining the appropriate course of action. Client experiencing joint pain during exercise requires careful assessment to differentiate between normal muscle fatigue, minor discomfort, and potentially serious injury. The trainer must balance the client's desire to continue training with the paramount responsibility of ensuring their safety and well-being. Failure to accurately assess the situation could lead to exacerbating an injury, causing further harm, and potentially violating professional standards of care. Correct approach analysis. The correct approach involves a systematic assessment of the client's pain, including its location, intensity, quality, and the specific movements that elicit it. This aligns with the ethical and professional responsibility of a personal trainer to conduct thorough client assessments and to recognize the limits of their scope of practice. By gathering detailed information, the trainer can make an informed decision about whether to modify the exercise, recommend rest, or refer the client to a qualified healthcare professional. This approach prioritizes client safety, adheres to best practices in exercise programming, and demonstrates a commitment to professional integrity by not overstepping boundaries. It is consistent with the general principles of client care and risk management expected of certified personal trainers. Incorrect approach is analysis. Ignoring the client's reported pain and continuing with the prescribed exercise program is a significant ethical and professional failure. This approach disregards the client's subjective experience and the potential for harm, violating the trainer's duty of care. It could lead to further injury, prolonged recovery, and a loss of client trust. Suggesting the client push through the pain is also a dangerous and unprofessional approach. This advice can normalize harmful exercise practices and encourage the client to ignore warning signs of injury, potentially leading to more severe damage. It demonstrates a lack of understanding of exercise physiology and injury prevention. Immediately stopping all exercise and recommending complete rest without further assessment is also not the most appropriate initial response. While rest may be necessary, a more nuanced approach involves understanding the nature of the pain. This approach might be overly cautious and could unnecessarily halt progress or lead to deconditioning if the pain is minor and manageable with modifications. It fails to utilize the trainer's skills in exercise modification and assessment. Professional reasoning. When faced with a client reporting pain during exercise, a personal trainer should follow a structured decision-making process. 1. Listen attentively and empathetically to the client's description of the pain. 2. Conduct a targeted assessment to gather specific details about the pain, location, intensity, type, aggravating/alleviating factors, onset. 3. Based on the assessment, determine if the pain is likely related to exercise fatigue, minor discomfort, or a potential injury. 4. If the pain is minor and clearly exercise-related, modify the exercise to reduce stress on the affected area or substitute with an alternative exercise. 5. If the pain is significant, persistent, or suggestive of an injury, cease the aggravating activity and recommend the client seek evaluation from a qualified healthcare professional, e.g., physician, physical therapist. 6. Document the client's report, the assessment findings, and the actions taken. 7. Maintain clear communication with the client throughout the process. Question 19. Examination of the data shows a personal trainer is working with a client who reports a sharp, localized pain in their knee during the eccentric phase of a squat. The client states they want to continue the exercise, believing it's just pushing through. What is the most appropriate course of action for the personal trainer? Option A. Encourage the client to push through the pain, explaining that discomfort is a normal part of building strength and that their determination will lead to results. Option B. Immediately stop the exercise, ask the client to describe the pain in more detail, e.g., location, intensity, what makes it worse/better, and if the pain is significant or persistent, recommend they consult a healthcare professional. Option C. Immediately prescribe a series of knee stretches and foam rolling techniques to alleviate the pain before resuming the squat. Option D. Stop the exercise and suggest the client take a week off from all lower body training to allow for natural recovery. The correct answer is B. Immediately stop the exercise, ask the client to describe the pain in more detail, e.g., location, intensity, what makes it worse/better, and if the pain is significant or persistent, recommend they consult a healthcare professional. Explanation. Scenario analysis. This scenario presents a common challenge for personal trainers, identifying and responding appropriately to a client's reported pain during exercise. The trainer must balance the client's desire to push through discomfort with the imperative to prevent further injury and adhere to professional standards of care. Misinterpreting the pain or overreacting can lead to either a missed opportunity for intervention or unnecessary cessation of a beneficial exercise. Correct approach analysis. The correct approach prioritizes client safety and evidence-based practice, aligning with the ethical and professional guidelines expected of a certified personal trainer. This involves immediate cessation of the aggravating activity, thorough assessment of the pain's nature and location, and referral to a qualified healthcare professional if the pain is severe, persistent, or indicative of a potential underlying condition. This approach upholds the trainer's duty of care, prevents exacerbation of injury, and ensures the client receives appropriate medical attention when needed, which is a cornerstone of responsible practice. Incorrect approach is analysis. One incorrect approach involves dismissing the client's pain as a normal part of exertion. This fails to acknowledge the client's subjective experience and could lead to the progression of an injury. Ethically, it demonstrates a lack of attentiveness and a disregard for the client's well-being, potentially violating the trainer's responsibility to act in the client's best interest. Another incorrect approach is to immediately prescribe specific stretches or exercises to alleviate the pain without a proper assessment or referral. This constitutes practicing beyond the scope of a personal trainer's certification and expertise, potentially causing harm. It bypasses the necessary diagnostic steps and could mask a more serious issue, leading to regulatory and ethical violations related to scope of practice and client safety. A third incorrect approach is to simply stop the exercise without further inquiry or assessment. While stopping the exercise is correct, failing to gather more information about the pain's characteristics, e.g., sharp vs dull, location, onset, and not considering referral if warranted, limits the trainer's ability to provide comprehensive guidance and support. This approach is less about direct harm and more about a missed opportunity for effective intervention and a less thorough application of professional judgment. Professional reasoning. When a client reports pain during exercise, a personal trainer should follow a structured decision-making process. 1. Immediate cessation of the aggravating movement. 2. Active listening and questioning to understand the nature, location, and onset of the pain. 3. Observation of the client's movement and posture. 4. Assessment of whether the pain is musculoskeletal, joint-related, or potentially indicative of a more serious condition. 5. If the pain is sharp, severe, persistent, or accompanied by other concerning symptoms, referral to a qualified healthcare professional, e.g., physician, physical therapist, is paramount. 6. If the pain is mild, transient, and clearly related to muscle fatigue or a minor strain, the trainer may, within their scope of practice, adjust the exercise program, modify intensity, or suggest appropriate recovery strategies, always prioritizing client safety and comfort. Question 20. Performance analysis shows a client's heart rate recovery is significantly slower than usual following a high-intensity interval training session, and they report feeling unusually fatigued and experiencing mild dizziness. What is the most appropriate immediate course of action for the personal trainer? Option A. Immediately inform the client that they are likely experiencing a serious cardiac issue and recommend they seek emergency medical attention. Option B. Continue with the planned cool-down and stretching routine as scheduled, assuming the client will recover naturally without any intervention. Option C. Encourage the client to push through the fatigue, as this is a normal sign of adaptation to intense training and will lead to greater fitness gains. Option D. Advise the client to rest and hydrate, monitor their symptoms closely, and consider reducing the intensity or duration of the next session, while noting the observation for future programming. The correct answer is D. Advise the client to rest and hydrate, monitor their symptoms closely, and consider reducing the intensity or duration of the next session, while noting the observation for future programming. Explanation. This scenario is professionally challenging because it requires the personal trainer to interpret physiological data and apply it to an individual's training program, while also considering potential health implications. The trainer must move beyond simply observing performance metrics to understanding the underlying metabolic responses and their significance for the client's safety and progress. Careful judgment is required to differentiate between normal physiological adaptations and potential warning signs that might necessitate a modification of the exercise intensity or duration, or even a referral to a medical professional. The correct approach represents best professional practice because it prioritizes client safety and well-being by acknowledging the metabolic stress indicated by the data and taking a conservative, informed action. This aligns with the ethical responsibility of a personal trainer to act in the best interest of their client, which includes understanding and responding to their physiological state. It also reflects a commitment to evidence-based practice, using performance data to guide training decisions. This approach is consistent with the general duty of care expected of certified personal trainers to monitor clients and adapt programs as needed. An incorrect approach that focuses solely on pushing the client to achieve higher performance metrics without considering the metabolic strain would be ethically negligent, disregards the potential for overtraining, injury, or adverse health events, violating the trainer's duty to ensure client safety. Another incorrect approach that involves making definitive medical diagnoses based on the metabolic response would exceed the scope of practice for a personal trainer, potentially leading to misdiagnosis and inappropriate interventions, which is a regulatory and ethical failure. Finally, an approach that ignores the data altogether and continues with the pre-planned session without any adjustment would demonstrate a lack of professional diligence and a failure to utilize available information to optimize client care. Professionals should use a decision-making framework that involves 1. Data interpretation, understanding what the performance and metabolic indicators signify. 2. Risk assessment, evaluating the potential risks associated with the observed physiological responses. 3. Scope of practice, determining appropriate actions within the trainer's professional boundaries. 4. Client-centered care, prioritizing the client's immediate and long-term health and safety. 5. Consultation, knowing when to seek advice from or refer to other healthcare professionals.